I've got a serious situation here. My pilot has gone incoherent, and I have no idea how to fly this airplane. But I'm maintaining 90-100.
Yeah, it was just a routine flight back to Fort Pierce. Nothing out of the ordinary. I think I was descending from 12,000 to 10,000 feet. The right side of my head just started pounding. Like every time my heart would beat, it would just pound. And I could see little blue lights.
And then he reached for a drink and he said, I have a splitting headache.
Told my guys, I said, guys, I got to tell you, I don't feel well.
And that was it. And he just kind of drifted off. Yes, things went through my head like, what are my chances? And I'm thinking, not very good.
Ken Allen is the pilot who lost consciousness while flying his Cessna Caravan, leaving his passenger, who had no flying experience, to successfully land the plane at Palm Beach International Airport. Once the plane landed, Ken was rushed to the hospital and was initially believed to be suffering from a stroke.
So we went and changed vehicles on the tarmac and then went to St. Mary's.
All we were told was there was a 60-something-year-old male with possible stroke alert coming to our hospital. When I first attended to Mr. Allen, I noticed that he was exhibiting signs of a possible stroke.
Being a level 1 stroke center at St. Mary's, everything is protocolized. Somebody comes in with stroke-like symptoms, it's like they push a button and all of these things happen to try and make the diagnosis.
Once we identified that it was an aortic dissection, I wasted no time and I called Dr. Patel right away. From the minute of the diagnosis, I knew that he needed to be under the care of a cardiovascular surgeon.
All I'm hearing from Dr. G is he's got a dissection with stroke-like symptoms and it's just go time. So let's get the patient over here.
And our EMS is so close, we were able to get the patient transferred over with no delays at all.
When we got the call that Mr. Allen was on his way, the team really pulled together to get the room available, to get all equipment in the proper place. This type of procedure usually requires a little bit more than a regular open heart procedure. If this patient doesn't get to the operating room, chance of dying is 100%, right?
And the whole objective prior to surgery is to prevent that tear from worsening and rupturing, which would be life-ending.
There were people all over him, getting him ready for surgery.
We just got home from a trip. Didn't want that to be the last time we went somewhere together. I thought of my kids, grandkids, a lot of different things.
And the idea behind repairing a type A dissection is to remove the torn aorta, and that's the very first part of the aorta. We call it the ascending aorta. The part that can be life-threatening, life-ending if it ruptures.
Well, Mr. Allen came out of surgery the night before my shift, so when I arrived at 7 a.m., he was still on the breathing tube. When we were able to take the tube out shortly after I arrived that morning, neurologically he was intact, which was a huge miracle.
Well, I think it was a fateful journey that day to get me here. I really can't say enough about Palm Beach Gardens or St. Mary's. I mean, I had some great people.
You know, our network of hospitals is excellent in that we have a specialist for every patient need.
It's great that I have colleagues at other hospitals like St. Mary's, Good Samaritan, West Boca, Delray, and here at Gardens, that we can send patients within network to colleagues that we know and trust that are excellent, well-trained, communicate well, and take great care of patients. And that really is what ensures excellent outcomes. You know, cardiac surgery is a team sport. You cannot perform these kinds of operations without a well-oiled machine, without a team that is experienced, that knows the gravity of the situation, and that's what we have here.
You can tell they love doing what they do, and that a patient is not a burden. It's an opportunity for them to practice their skills and profession, and it shows, because in that sort of condition, every second counts.